Hi, I'm Chris Patterson. I'm in Integrative Studies 4350. This is my thesis oral presentation. I'd just like to go over what I researched and studied, which is human trafficking. The reason why this is so problematic is due to the invisibility that it provides to the criminals, and they're using somebody in front of them, so they're kind of in the background. The real problems are to identify those people who are being trafficked. The difficulty also gets into the victims' ages and what type of trafficking they're involved in. Men, women, and children are all being used to further this illicit behavior of those who are out for the profit of it. You know, drugs, sex trafficking, labor trafficking, and stuff like that. The ability to determine the causal links in the human trafficking can be a major difficulty, and these links can shift from different types of human trafficking. This is not a problem where people will voluntarily just walk in and explain what they're going through and telling the professionals that hey, this is what I'm involved with. There are more hidden agendas that they're doing. Take for example, prostitution. If they go seek medical assistance, they're not going to walk in there and explain to them they're a prostitute. They're just going to go in there explaining that they have a sexually transmitted disease and they need treatment for it. The ability to identify the victims and causes and post-care will come from different aspects from many different professionals, such as law enforcement, psychologists, social workers, doctors, and many others. This problem cannot be stopped and will continue, but can be lessened if the ability to identify victims, why and how they entered into human trafficking, and the ability to attack this issue. The staggering numbers that are reported from the National Human Trafficking Hotline in the past 8 years were 31,600 human trafficking cases, and that's around 3,900 per year. The people who are being trafficked will likely come in contact with law enforcement or use services in the community to seek medical care. Along with these medical care issues, these individuals will need preventive medicine and behavioral science providers to assist them in dealing with post-traumatic care after they get out of the trafficking. This problem needs the help of other people in different areas for the prevention and elimination of this horrible epidemic. Our view of this problem needs to be focused on pre-trafficking indicators, trafficking indicators, and post-treatment and services for the individual. The first difficulty in bypassing human trafficking complex is to have people look at the broadness that this issue encompasses. When people talk about human trafficking, other people kind of think about the border with U.S. and Mexico, where human traffickers smuggle people across the border for profit. There are more than just border crossings and the use of human trafficking in that aspect. The first is to educate people about the complex problem of human trafficking entails, which is defined as the transportation and subjugation of persons for financial gain with global earnings of over $31 billion a year. The research is more focused on the sex trafficking aspect, which is the most commonly identified form of human trafficking. These are the prostitutions and the prostitution rings that are enveloped in the country. Other areas of this problem which people are forced to engage in these acts put children more at risk of being trafficked in sexual exploitation, begging, organ harvesting, and domestic servitude. This complex problem is not solely run by men, and there are some women who are also traffickers. The perception of males being the dominant person who is responsible for human trafficking is a myth, and 46 countries suggest that women play a key role in perpetrators in human trafficking. In Europe, these convictions by women in human trafficking outpace those of other crimes. Take, for example, the prostitution rings that envelop this country. You have what they call a pimp, and that's their street name, their legal name. And then you have prostitutes. When the organization gets bigger, you have the prostitutes who kind of take over as the head pimp for the actual pimp themselves, and they start running the females below them. This happens a lot in the bigger prostitution rings, and that's what we see in law enforcement. The complex problem of human trafficking is a difficult crime to gather the data necessary, because just the reluctance of the victims. They don't want to identify, and the ability to identify others, recognize who is not a victim. I mean, you got to understand that when these people come forward or be arrested by law enforcement, it's usually for prostitution or other illegal criminal activity that they're involved with. And usually that is their source of income. They're not going to turn in their pimp or their drug dealer because they got arrested, because they'll eventually get out of jail or whatever and go back to that lifestyle. That's kind of where we have to step in, identify those people, and kind of tell them that there is an afterlife past human trafficking. There must be improvement, though, however, in law enforcement training of officers and increased prosecution efforts to stop this crime. The professionals must be able to identify the victims. The disciplines that human trafficking is starting to touch are expanding in the medical field. It is being seen as a public health issue, which the public health approach is needed from medical providers. I mean, you have such as prostitution, you have these females and males coming into the hospital because they're being treated for STDs or other medical issues that come upon them. They come in sometimes with or without their pimp, depending on how their level is of security. They get treated and then they're out the door. We need to, as professionals, and especially the medical professionals in that aspect, they need to indicate those people as human trafficking through questions and solve it, and not just push them in and out the door. And it is important to solve this problem through an interdisciplinary approach, because one discipline alone is not enough to attack the problem. I mean, you take law enforcement, for example. All they really do is we go out and arrest, make an arrest. Sometimes if it leads to something higher, take a prostitute, for example, they're arrested, and then if the pimp is identified, they may be charged with promotion of prostitution. You know, that's just where it ends. Usually they'll get in and out of jail and go on. Law enforcement is very minor cog in the wheel, and the street officers find the problems, they deal with the problems, and unless they're in a specific task force for human trafficking, they're not really looking at the overall scope of the problem. They're more looking at the criminal action at that moment, and putting that person in jail, going on and going to the next crime in progress, or the call for service that they have. Medical providers could also engage with the person who's being trafficked in private clinics, private practices, urgent care centers. They look out for victims for a variety of reasons, including sexual assault, physical injury, infections, complications, substance abuse, overdoses, injuries, pregnancy testing, contraceptives, and other reproductive issues. That's especially what the medical professionals can help in identifying these people in human trafficking. Like I mentioned earlier, human trafficking, especially in the law enforcement profession, is a very complex issue. And there are so many perpetrators out there, and the type of exploitation, and especially sex and labor and other methods, is very hard to track down. Especially when you have so much going on with the victim don't want to prosecute. That is their lifestyle. But we have to look at the social and economic and cultural aspects of how they got into the human trafficking world. One of the problems that law enforcement does have is the identification of human trafficking, and there have been several law enforcement officers. They just do not understand that what specifically they're looking for in human trafficking. Like I said before, some may view it as somebody's crossing the border. Some may view it as the prostitution and the pimp. However, they're a labor. Those are the kids. And now with social media coming out there, you have dealers, drug dealers. I mean, there are so many aspects to this crime that is a very big and large thing that law enforcement itself cannot deal with. However, they do need to understand that they need to identify those people who are in human trafficking, and that is one of the biggest problems in law enforcement, is they're unable to identify people who are engaged in human trafficking. I mean, especially outside the realm of the sex trafficking issues. Just for example, the women who are arrested for illegal entry into the country for smuggling narcotics, they're on the sides. They can be a victim or they can be an offender. You know, most of them are probably trying to get over here to the country, or they're trying to pay for their family in Mexico. But when they cross the border with illegal narcotics, they're treated as offenders. And law enforcement needs to, yes, treat them as offenders at the beginning, and then kind of go in following up with that and make sure that, hey, this is, you're a victim, if they are in fact a victim of human trafficking, and try to get them out of that environment they're in. But the difficulty in identifying a victim is the lack of knowledge, the stereotyping trafficking victims, identifying perpetrators as victims, and difficulty interviewing misleading signs in the identification process. The victims will not self-identify with law enforcement. They won't. Victim cooperation is essential to detecting and prosecuting human trafficking. If we don't have that, then it's very hard to go to that senior level of the human trafficker and divert them or take them out, because now we have somebody who won't cooperate with law enforcement. Now, there have been laws that have been enacted which are called safe harbor laws in some states, and if the victim aids in the investigation and the prosecution of the sex trafficker, they're kind of immune from prosecution, but they need to help law enforcement do that. Healthcare and criminal justice professionals are not able to identify without the training necessary to recognize people who are being trafficked. Once they have certain signs that necessary, once they identify a person through that training, to ask certain questions that will assist them identifying the people being trafficked. And the medical professional side, they are concerned with treating the patient and more likely to see a person trafficked due to healthcare issues that they may endure in their profession. In the criminal justice side, where law enforcement is concerned, we're less likely to encounter people who are being trafficked unless their law enforcement duties are in a border city or in a specialized unit to apprehend sex offenses and stuff like that. Sometimes they will come across in a traffic stop or something that people are in the back of a truck being trafficked, but it usually has to do with sex trafficking, labor trafficking, and stuff like that. Another setback for law enforcement is when a person is trafficked, the officer focuses on the substance of the arrest rather than looking farther into the rabbit hole. We need to understand that this person may be a victim, although they are an offender, and they'll still go through the process. But we need to dive deeper into what and how they got to where they're at. They're just law enforcement is in a vicious cycle. They go into one call to another call to another call, an arrest, they book a person in, and then they continuously go from call to call. So there's not a lot of time for some of them to do the process that they need to be involved with, especially in human trafficking. However, there needs to be cooperation between police and social workers to gather respect and to use those outside agencies and professions to assist them with human trafficking, because you never know. Police officer may encounter a situation where a child has truancy problems at school. Parents are not wealthy, but they have expensive items such as clothing, jewelry, wear lots of makeup. to a social worker who would see this as a child being sexually exploited. The cooperation of the two entities may serve a greater purpose. So we need to kind of look at that. An avenue in which a nurse or police officer may not feel that would be in their role questioning a person, but we need to get past this. We need to understand and start questioning people a little bit further to understand if they are in being trafficked. And really, in conclusion, the first step in human trafficking is to identify the victim through extensive training and be able to interview the victim. These identifications will lead to direct the victim in a way they can become a survivor. The direction may be to a psychologist to help the survivor mentally hurdle the barriers set in front of them, or to a medical professional to overcome the diseases that they may have contacted through sexual exploitation. On the financial side of it, it's not as simple as we think it is, but we need to get them into some sort of gainful employment, government services like medical insurance, food stamps, and welfare systems to pull them out of the human trafficking role when they've been involved with. By giving these victims this door to walk through and assistance, it can help them detach from that hook that they got into their mouth. It will help them strip their independence from the trafficker's ability to keep them isolated from others, being manipulated, intimidated, and financially controlled. Identification of victims is crucial in the initial start of the process to transform victims into survivors. Every problem we have to identify, analyze it, we need to use. With the right training, we can identify a victim in human trafficking with the right questions to ask, the ability to get them connected with proper services. This complex problem will be slowed down or stopped from happening over and over. In 2012, President Barack Obama said that human trafficking should be a concern for every person because it tears the social fabric of our society. It endangers public health, fuels violence and organized crime, and referred to as modern-day slavery. I appreciate you listening to this presentation of human trafficking, and thank you for your time.